I came to see Dr. Varughese on the advice of my primary care physician because my blood pressure was a little elevated and my EKG reading was a little off. She suggested that I take a stress test and have some other procedures done just to determine the causes of that. And it was determined that I did have blockage in one of my arteries and a stent had to be implanted. And then reality sunk and Dr. Varughese talked to me during the recovery time, and I asked her, in tears, I asked her what was going on. I asked her, was I about to have a heart attack? And she said, yes.
Yolanda Garcia, to this day, she's so thankful that her primary care was cognizant enough to send her for evaluation, because many times primary doctors or nurse practitioners who see all of these patients, they may not recognize because the patient's not complaining much. So I think this is a wake-up call for all of us as physicians and healthcare providers to really focus on prevention, evaluating the patient early, getting them to the right specialist on time.
Because of her, I'm able to take care of my clients. Because of her, I have a better life. So I really am appreciative of all she has done for me.
Well, coronary disease in women especially is it's the #1 killer of women in this country, and pretty soon will be the #1 killer of women all over the world. And in Hispanic women especially, there's a high prevalence of diabetes. So therefore diabetes lends towards cardiovascular disease and coronary disease especially. It's just so important to educate our Hispanic population, our Indian population, because Indians die 4 times the rate of any other population from diabetes and cardiovascular disease. People are hungry for knowledge. It's just for the lack of knowledge we perish.